Hey, so thank you for the introduction and welcome to the Patient Safety Day for 2022. I'm very happy to be here to speak about medication without harm. And for my presentation, I will be focusing on the role of patients in achieving medication without harm. And so, by way of outline, I will have an introduction that gives us a quick overview of the issues around medication without harm, and then also mention the key issues around medication without harm. We'll talk about achieving medication without harm. What are the roles of the different players, particularly patients, in achieving medication without harm? And then I will conclude the session. So by way of introduction, in 2005, the WHO started a global patient safety challenge, basically with the idea to enhance patient experience with the healthcare delivery system. And incidentally, the third of the WHO Global Patient Safety Challenge is around medication without harm. This challenge was launched on March 29, 2017, and it aims to reduce severe avoidable medication-related harm by 50% in 5 years. And incidentally, this year, 2022, of course, marks the 5th year of this challenge. And I think it is planned or otherwise, it is a good thing that this year also we are looking at the issues around medication without harm and how we can improve patients' experience from healthcare delivery, healthcare delivery practices. And then to support the implementation of the medication without harm challenge, patient safety challenge, the WHO developed this framework that is meant to help implementation or achieving the aims of the medication without harm challenge. The strategic framework has 4 main domains around the healthcare provider and the healthcare provider. It has the medicine domain, and it looks at the systems and practices of medications. And then the 4th domain is around patients and the public. And each of these 4 major domains also has additional 4 subdomains for a total of like 16 subdomains that look at different areas around healthcare delivery by healthcare providers, the medications, the systems, and the patients who use who seek care and use the medications that are produced. And then finally, the WHO also identified 3 key action areas where this strategic framework, where the priorities can be operationalized. And those 3 key areas include the area of polypharmacy, where patients are given several medications at the same time. We're looking at the second area, which is high-risk situations, where patients have medications that are very sensitive, or patients who are in very serious healthcare, who have very serious healthcare conditions. And then the third domain is in transitions of care. So these are the 3 main domains, key areas where the medication without harm, it's kind of going to be focusing on to ensure that patients are protected in the process of seeking care. And for us, for this presentation, I will be looking at why do medication errors occur? Why do medication harms occur to patients? And for us to get a better understanding, I have kind of grouped those 4 domains into like 3 domains. So I'm looking at 3 main failures that lead to medication errors. The first failure being failure within the system, and the system encompasses like the regulatory system, where the medicines are produced, and then the healthcare delivery systems where the medicines or medications are then used with the patient or given to the patients. And then we have the domain of the healthcare provider, as I had mentioned earlier from the framework. We have the domain of failure by or from the healthcare providers that interact with the patient. And then the third domain that I will also be speaking about is the patient and the public related failures. And this is kind of where we know on this Patient Safety Day, it makes sense for us to interact with our patients and show those areas that patients can take control, patients can be engaged, patients can be empowered to make sure that we achieve medication without harm. Now, looking at, again, looking at the healthcare delivery system, I think it's important to understand where are the main points of error within the healthcare delivery system. And several studies have been done. 3 main areas have been identified as main points of error or harm within the healthcare delivery system, with the first being around the area of prescribing and transcripting of medicines, with that area accounting for 60% of all errors that are that occur within the healthcare delivery systems. And this usually occur around unclear prescriptions from prescribers, where prescribers use abbreviations that are difficult to understand, or when whoever is reading the prescriptions is unable to interpret the handwriting of the prescriber, as exemplified by the image on my screen, where you see something like flu mist or flu shot. So when for somebody who is not familiar with reading this writing, it's very easy to make a mistake in trying to understand what exactly was prescribed here. The second area where errors and harm tend to occur is in the area of administration. And for this, it's been identified that 30% of errors or harm that occur within the system are around the area of administration. It could be misadministration of medication to patients. It could be misinterpretation of medication orders, or it could be miscalculation of doses that have been prescribed to patients. And then finally, the third area where errors also and potentially harm do occur in the healthcare delivery system is around the area of dispensing. And studies have shown that this accounts for about 10% of harms or error that occurs and could potentially lead to harm for patients. And this usually stems around patient counseling or patients not being able to understand or sufficiently interpret verbal orders that have been given to them for the use of their medication. And then the question then is, with knowing where these errors occur, why is it that errors continue to occur? Why is it that medication errors and harm persist within the system? And there are several factors that are responsible for this. I will just speak on a few today, very briefly. I think one of the key things is the fact that medication errors that happen within the healthcare system are not catastrophic in that sense. So people don't see them as catastrophic events, and so they often don't tend to be newsworthy compared to errors or accidents or harms that happen in an industry like the aviation industry. If there is a plane crash, it is huge news, because yes, so many lives are lost, and then it's plastered all over the news and people get to hear about it, and people, action is usually taken. But within the domain of healthcare delivery, perhaps because it happens to one patient at a time, it doesn't feel catastrophic, and so it doesn't get sufficient media coverage to raise awareness. And that is why days like this, where we celebrate the Patient Safety Day, offer us the opportunity, to raise awareness, to create awareness about these harms that are happening. And most times they go undetected. Another factor that also contributes to the persistence of medication harm within the system is the fear of blame or negative consequences for reporting, both on the part of the healthcare provider as well as the patient, the public. And then there is also uncertainty on the part of both healthcare provider and patients about what actually caused this harm or the error that is being experienced. Sometimes people are not sure what is the reason for that. And so they feel reluctant to also, report those errors or those harm. And then there is also poor awareness of existing systems for reporting. Sometimes people simply just do not know that there are systems that they can report. And in some cases where they do know the systems exist, they don't have confidence in that system to be able to protect them from the harm or to offer any reprieve, from the harm that they may have experienced or from the error that has occurred. And then another factor is the fact that both on the part of the patient and the part of the healthcare provider, there is this perception, particularly if for those of us from this part of the world, from developing countries, there is the perception that patients do not have the agency to understand healthcare-related issues. And so usually patients are not engaged in discussions around their health, So that lack of engagement also leads to situations, as we would see in a few slides down. That lack of engagement leads to potentials for error and then harm eventually happening to the patient. And then there is also the human aspects, the carelessness, both from on the part of the healthcare provider as well as the patient, as I would also show a little further down. There is carelessness on these parts that could lead to harm and do lead to persistence and perpetuation of harm within the healthcare system. And then finally, of course, is the fact that there is a general system failure where the complex healthcare and regulatory systems, kind of just fail, and then harm continues to happen. And then the question we'll then ask ourselves is it possible, hearing all that we have heard, how can we achieve medication without harm? Is it possible? And if it is possible, how can we achieve it? And so I think empowering patients, of course, is very key part of trying to achieve medication without harm. And in that respect, WHO has come up with several materials that are meant to empower the patient, that are meant to build the capacity of the patient to be able to take control, to be able to be an active member or active participant in their healthcare delivery effort. So WHO has developed several materials, including the ones that I'm showing on my screen, which have been developed for the Patient Safety Day, and I thought they were quite apt to be sharing and talking about them on this day. And so we have these three things you should know, you should check as a patient. There are three key things you should know, you should check, and you should ask. And as we go talk about the different roles that the different players would play, we would talk about the different elements. For the patient, what does it mean to know? For the healthcare provider, what does it mean to know? For the patient, what does it mean to check? And what does it mean to ask, as well as the healthcare provider? So we'll talk more about these when we're looking at the different roles of the different healthcare providers. Now, but staying on this, WHO has also developed this material on the 5 moments for medication safety that, again, is aimed at empowering the patient to know particular moments in their healthcare journey that they can be active participants in their healthcare seeking process and in ensuring, or at least working towards achieving medication without harm for themselves as patients, for their family if they're the caregivers, So the first of the 5 moments of medication safety is at the point of starting a medication. So at the point of starting a medication, the patient has a role to play by asking several questions, including, what is the name of the medicine that I am being given? The patient always has the right to know what is the name of the medication that I am being given. You would find that in many parts, in our parts of the world, in the developing parts of the world, I have spoken countless times to my family members who have had a visit to the doctor, and something as basic as asking, what medication did they give to you? Or what did the doctor say was wrong with you? And you get a response that I don't know. They didn't tell me what they thought was wrong with me, and they didn't give me the name of the medication. I was just given a medication and asked to take. So it is very important that patients know what is wrong with them, what are they being diagnosed with, and what are the medications they are given. And in addition, patients should also know if there are adverse events that they expect to experience with those medicines. So at the point of starting, patients should ask to know those things. At the second moment for medication safety, according to this patient support tool that has been provided by WHO, is at the point of taking the medication. So at the point of taking the medication, the patient also has the responsibility to know when he or she should take the medication, how much of the medication should be taken, what should the medication be taken with, and at what time should the medication be taken. And then also in taking that medication is also a point for the patient to ask once again, are there any side effects that I expect to experience after the use of this medication? And then the third moment for also trying to achieve safety for a patient is at each point of visit with the healthcare provider, patients should be able to take the opportunity to ask about medications, particularly if a healthcare provider is going to give an additional medication to the patient. Patients should be able to ask the healthcare provider, do I really need this additional medicine that's been given to me? And the healthcare provider as well must also constantly ask themselves, does the patient need this additional medication that I'm trying to give to them, or can we manage the patient in any other way? And then in addition to that also is to ask the question around interactions. Will the medication that I'm being given now interact with the medications I'm already taking? It also provides, this moment provides an additional opportunity for the patient to have the conversation with the healthcare provider around other medications and other things that the patient may be taking that could potentially influence how their medicines behave. And then the fourth moment of medication safety is once again at the point of reviewing your medication. So at each visit, when the patient sees the healthcare provider, it always offers an opportunity to go through the list of medications that the patient has and find out if all of the medications the patient has at that point in time are still relevant for managing the patient's condition. And finally, the fifth point is, when you realize that a medication is no longer needed for a patient's management, then it's important to stop, So for these moments, these 5 moments present opportunities for both the patient and the healthcare provider to continuously review the patient's medication use journey to determine at what point medication should be taken, when it should be taken, when it should be reviewed, once it's reviewed, what should be taken off the list, what needs to be brought back. All those decisions around taking of medication, a patient ought to be an active participant in those conversations. And so talking about the patient rules, I think this is being a bit repetitive, but we can never repeat it enough. When it comes to safety, we can never repeat it enough. So it's important to say patients ought to know their medication, know the medication you're being given, know the name of the medication, know how to use the medication, make sure that you check the dose and the timing and what you can take it with, and then always ask. When it is not clear, always ask. So bottom line, patients need to actively participate in the healthcare-related decisions around them and their family members. Whether you're the patient or you're a caregiver, it is important for a patient to be an active participant in their healthcare delivery. Finally, patients are also encouraged to report any medication-related error or harm that they may experience. These are some of the roles that patients how a patient could have played a better role in preventing medication without harm. So this is a story of a 6-year-old girl who had gone to see a clinician and was prescribed albendazole by the clinician. The pharmacist got the prescription, then dispensed sulfadoxine pyrimethamine instead of the albendazole that had been prescribed for the patient. The caregiver of this child, who was aware of what the doctor intended to prescribe for the patient, did not check what medicine had been dispensed before leaving the hospital. It was at the point of administration that the healthcare provider realized what medication had been given to the patient instead of what was intended by the doctor. Now, fortunately for this child, this error was picked and no harm came to the child. But this is an occurrence that is quite common and patients need to be aware of. And the lesson from this is at each point a patient has a visit to the hospital and has a prescription and is dispensed a prescription by a pharmacist, the patient must always cross-check to make sure that what was prescribed by the physician is what was dispensed to the patient and what the patient eventually goes home with. Because sometimes people might not be careful enough to cross-check what they are being given, or they might simply just not know, and then they will take it. And then later on, we will see another example where the patient wasn't so lucky. So the second part, the second role, the second group of people who have a core role to play in achieving medication without harm is the healthcare provider. And here also, WHO has also developed the materials for the healthcare provider and those questions that the healthcare provider needs to ask before or during a medication interaction with a patient. So the healthcare provider, before giving any medication, is advised to know the medication and know their patient. Know the medication you are prescribing for your patient. The healthcare provider is advised to check that they have the right patient, they have the right medicine, they have the right route of administration, they have the right dose that is given to the patient, and they have the right time that the medication should be given to the patient. And very important, healthcare providers do need to constantly check with the patients that they do understand the instructions that are given to them. So healthcare providers need to ask patients if they understand. I think it's a very good practice for healthcare providers to possibly ask the patient to repeat the instructions that they were given to them, because it's in the process of verbalizing those instructions that the patient might realize, oh, I'm not very clear about what those instructions are. So I think it's very good practice to have the patients verbalize those instructions or repeat those instructions to be sure that they really understand those instructions. And the healthcare providers also can be an active part in educating and engaging patients and caregivers in their healthcare delivery. I think we should give credence to patients that they are able to understand to some extent, you know, what is happening to them. I think patients might probably be the best the best people that know about what's happening to them. And so they are the best resource that we have in knowing about what's happening to them and what's going on around them. And so they should be actively engaged by healthcare providers in the process of healthcare delivery. And I'll share a second example of a patient journey where I mentioned that this patient unfortunately wasn't so lucky. And this was a compounding error. So it's an 8-year-old child, boy this time, who had been experiencing sleep disorders and had been prescribed L-tryptophan for several years. The patient had been on that medication. And so at one of the doctor visits, the medication was prescribed for the patient and was taken to the hospital, to the pharmacy for compounding. Now, unfortunately, instead of the L-tryptophan powder, baclofen powder was used instead of the L-tryptophan powder. And baclofen is a powerful muscle relaxant. And it was compounded with the same dose for L-tryptophan, which meant that whatever dose had been included in that mixture was strong enough to undo an adult. The healthcare provider, the caregiver, the mother of the child, who was unaware of this mix-up from the pharmacy, administered the mixture to the child as she normally would. And the child went off to sleep. But the child was then found dead in the morning because he had been administered a lethal dose of a medication that was never meant for him. So there is a lesson, of course, here. And the lesson here is for the healthcare provider to always, always double check, triple check, quadruple check to make sure that we're reading the labels on the medications that we're administering to patients, particularly when it comes, again, from the framework where those 3 areas of implementation of the medication safety, these are special situations where we need to be extra careful in what is administered to the patients. And then finally, we would look at also the healthcare system related issues, how the healthcare system can be improved to achieve medication without harm. So a study was done to try to understand what are some of the causes of medication error within healthcare facilities. And the study revealed several causes of harm, but the 3 major ones that were pointed out is the fact that there is workload. When there is workload increase for the healthcare providers, the tendency for error increases. When there are staffing issues within the system, the tendency for error increases. And then there is a lot of distractions for healthcare provider. One healthcare provider needs to do this while he's trying to do this. The phone is ringing, the other thing is happening. There's a lot of noise in the background. He or she is called to do something else. So all of these distractions contribute in no small way to making medication errors possible. And of course, with medication errors comes the potential of harm to the patient. And to be able to prevent that or minimize that from happening, we do need to look at the systems and how those can be improved. So we do need to build strong regulatory systems that start with the medications. How are the medications produced? The medications need to be of good quality. They need to be safe. And of course, granted, they need to be efficacious, but they need to be of good quality for our patients to be able to use them without harm. And then the healthcare delivery system itself needs to be strengthened. And we need to have safeguards that protect both healthcare users, including the patients and the people who deliver the healthcare. We need to find ways of minimizing errors, opportunities for error within the healthcare delivery system. And then very importantly, we need to establish no blame systems where people feel that they can report without having any harm come to them from reporting. And then, of course, with all of this is the need for continuous monitoring and strengthening of the system. It's a process that keeps that we need to keep going at all the time. And so in a nutshell, I would say that we all know that medication errors do occur. It's human to err, but we do know that a lot of the errors can be prevented. Achieving medication without harm is possible, but we must take deliberate steps to make that happen. We must have systems in place that protect the users of the systems. We must build safety processes into medication production and into the healthcare delivery system. And then most importantly, from the patient perspective, we must empower our patients. We must engage patients. We must help them to be active participants in the healthcare decision processes that affect them. And by empowering the patients, they serve as a check also for the healthcare providers to see that, you know, those potentials for harm, those areas for harm, those moments, possible moments of harm are reduced, or of possible moments of error that eventually lead to harm are reduced for patients. And so as I round up, I would just like to say thank you again for listening on this Patient Safety Day for 2022, sorry. On this Patient Safety Day for 2022, where we're talking about medication without harm, we know that it is possible. We know that empowering our patients can make it happen. And so we invite our patients to join us today so that we can work together and achieve medication without harm and have healthcare delivery experience more pleasant and more fruitful and more have better outcome for our patients. So thank you once again for listening, and do enjoy the rest of your day. And I wish you safety even as we continue to seek healthcare. Thank you.
Super. Thanks.
Are you guys still there?
Yes, yes, sure.
Okay.
Thank you so much. Very interesting presentation, Comfort. A really good message for our patients. So thank you. You did it incredible.